I'm Michelle Kerr, Workers' Comp Editor for Risk and Insurance and Chair of National Comp. Don't forget to save the date for this year's conference, October 20th through the 22nd. I'm here today with Silvia Sacalis, Vice President of Clinical Services for Healthesystems. Silvia joined us in December for the National Comp session, Empathy and Engagement, the process of putting patients first in workers' comp. That session is now available on demand at wcconference.com. I've asked Silvia to join me for a deeper dive into this important topic because engagement and empathy, more so than ever, are must-haves for our industry, not just nice-to-haves. Silvia, thank you so much for joining me today.
Hi, Michelle. Thanks very much for having me today.
So I thought I would start with the social determinants of health that we've spoken about before. There's an increased focus in recent years on the social determinants of health, and can you explain a bit more about how you apply an empathetic approach to these factors and how that improves outcomes?
Sure, absolutely. So social determinants of health really do have a major impact on health outcomes, especially for the most vulnerable populations, including our injured workers. Factors such as a patient's education, educational level, their income level, physical and social environment, all of these factors really must be considered when we are providing treatment and care to our injured worker population. Listening to the injured worker patient is key. It really helps us to uncover potential social determinants that that particular injured worker patient may be struggling with. You actually might be surprised how many quote unquote lifestyle details can be revealed in a one-on-one discussion with a patient about their medications. Factors such as nutrition, smoking status, current or former substance abuse issues, those all really do tend to come out in a one-on-one conversation. One crucial aspect of engaging an injured worker patient is the ability to always listen, and really listening without judgment and really trying to understand the full scope of what they actually are dealing with. For example, a patient who lives alone can have greater challenges than one who has a supportive family system at home in the household. So from my perspective as a clinician, patient engagement really presents an invaluable opportunity to empower our injured worker patient population to get involved in their own care. It really helps us to glean some valuable insight and to be able to further collaborate with other partners and providers to provide that appropriate support for each individual injured worker. These are really some of the most important considerations that improve overall injured worker outcomes.
Thank you so much for that. Those are all important points. In terms of using technology to create a more empathetic patient experience, we've spoken about things like telehealth and using technology to find the most appropriate provider match. What are some of the other ways that we can leverage technology to elevate the level of empathy in the patient experience?
We utilize and leverage technology and data mining to identify injured worker patients who are at risk due to factors such as problematic medications, early refills, or comorbidities. These factors put the injured worker patient at a higher risk for adverse outcomes. We use automated tools to help us find those injured worker patients who meet our high risk criteria, and then we further select them for intervention and engagement strategies. A significant component of empathy is acknowledging the preferences of the injured worker patient and building or adjusting our programs and processes to account for these preferences. An example of this is really making sure that when we are engaging with that injured worker patient, we're leveraging the type of technology that aligns with their preferences. For example, some patients like to use video for a more connected experience, while others really just prefer a simple telephone conversation.
That's really interesting too. Actually, I wouldn't have thought about some of that. When we're talking about applying empathy to solve for a worker's hesitance to report an injury, we're talking about creating a more empathetic patient experience even before the injury occurs, specifically in the form of education. What does that mean, and how do you approach it differently when you are applying the lens of empathy to it?
Thanks, Michelle. That's actually a good segue. Another finding in our study with injured workers was that 50% of them experience a delay in reporting their injuries, which can affect the entire course of treatment and recovery. Some of the reasons for the delay included weariness about workers' comp insurance, resulting from stories shared by others who had a bad experience, fear of being fired or experiencing some sort of retaliation from their employer, cumbersome paperwork requirements that make it difficult to complete while being in pain. Patients also complained about the amount of time it took to receive the workers' compensation forms in the first place, and felt that they really should be able to submit the claims immediately via online access or over the phone. In addition, participants in our most recent industry survey cited injured workers' unfamiliarity with the workers' comp system as the #1 barrier to recovery. So really, empathy can be applied first by understanding that our injured worker patients know very little about how our industry works, much less than we do as practitioners. As a PBM, we're not in a position to educate our patients on every aspect of workers' compensation, but we can try to put ourselves in the patient's shoes. And as an industry, more importantly, we can put more focus on easily accessible education and resources for injured workers. Employers can serve an important resource to educate employees about how the workers' compensation process works in the unlikely event they would experience an injury. This type of proactive approach really can help to minimize the delays in reporting of injuries and improve overall injured worker recovery. Again, very important. I don't want to lose sight of the fact that leading with empathy, employers and carriers can collaborate with their other provider partners, including PBMs, to assist with the treatment aspects of workplace injuries.
On the recovery side, can you tell me more about empowering the injured worker to become more active in their recovery? And what does that look like? And how does the empathetic approach apply? What are the behaviors that we're trying to motivate or sometimes avoid?
Sure. So I think in work comp, just like in group health, we are really overachievers. We want our patients to do all the right things. We want them to adhere to their medication regimens, attend their physical therapy sessions, and alert their providers to any other conditions or circumstances that could impact their overall care. If patients aren't doing what's best for them, chances are there are really good reasons. There's really no room for judgment and assumption in healthcare overall, from my perspective. We really should not assume that a patient has a bad attitude or doesn't want to go back to work. Instead, we really should treat our patients the way we all want to be treated by our healthcare providers, with caring and empathy for their situation. There's a lot of good research in general healthcare to show that provider empathy has a positive impact on patient health. Why should it be any different in workers' compensation?
Absolutely. And it seems so simple.
It is.
In terms of healthcare, what are some of the barriers posed by fragmentation of patient care, and how can a focus on engagement help break through some of these barriers?
I really appreciate this question because fragmented healthcare continues to be a challenge, not only in workers' compensation, but in healthcare everywhere. The fragmented healthcare system is really a barrier in itself to overall recovery. In fact, executive leaders who participated in our most recent survey cited ineffective care coordination as the second biggest barrier to patient recovery. Perhaps the biggest barrier posed by fragmentation of patient care is incomplete information. We talk a lot about treating the whole patient, and we do need to treat the whole patient if we expect to have an optimal recovery. But we only really know parts of that patient's history and circumstances as we're treating them. So by engaging patients and talking to them about their history and circumstances, we really can learn a lot. And once we establish that trusting relationship with a patient, it becomes much easier to uncover any pertinent details while also making that patient feel heard. Therefore, a key next step is to put the pieces of that puzzle together and then coordinate with all of the providers that are involved in the care of that injured worker patient to really ensure everyone is informed, everyone's on the same page, and we're all aligned when we're making any treatment recommendation.
Thank you for that. I have one more question for you, and this one is specific to pharma. You've spoken about how changes that have been made during the pandemic to ease patient access to treatment, increasing the need for vigilance to prevent misuse or abuse. When there's no longer a need for that, hopefully, we're no longer a need for that level of loosening of controls. What are the lessons that we've been learning now that will carry through in terms of outreach and education to providers as well as patients?
Yeah, thanks, Michelle. So while there's really no longer, like you stated, that need for that level of loosening of controls, there are some very important lessons that we've learned along the way, lessons that will continue to inform us and help us to further improve the way we engage with our injured worker patient population. It's important to continue to work with injured workers through the opioid crisis that does still exist post-pandemic. Education and outreach will continue to be essential. Our injured worker patients, they want access to trusted information. They want to know what to expect from their treatment regimen. And knowledgeable patients, as we all know, are much more empowered to help guide their own care. When patients are more knowledgeable about their care and their treatment, they become more confident and they're able to take ownership of any challenges or barriers that may come up. Things including, but definitely not limited to, depression or transportation or the complexity of their medication regimen. All things that we've uncovered by engaging with our injured worker patient population. When we reach out to patients and demonstrate empathy, we can create a dialogue, which really can help all of us enormously as we are identifying any potential medication errors or any issues regarding their treatment regimen. In our fragmented healthcare system, the patient is sometimes the only person who has all of the necessary information. So why leave them out? As we learned in a recent study that included interviews with injured workers, patients sometimes feel they're being overprescribed medications or the wrong medications. That's pretty significant. By reaching out and listening to our injured workers, providing very much needed education and counseling, as well as collaborating with their prescribers, we really can improve medication safety and overall care coordination, which is very important to workers' compensation and healthcare overall.
Thank you so much for your responses. I appreciate that in particular. I know the opioid crisis is still a big challenge for the industry. Thank you for sharing your insights today. I think we've done a pretty good job going deeper into some of the issues surrounding empathy and engagement, and I'm sure we'll be talking again soon.
Appreciate your time. Thanks very much, Michelle.